First of all, I just wanted to say thank you. I know this has been a challenging time for many people, including yourselves as business operators, adjusting to what will be a new normal for quite some time as we work through what the virus looks like in the days and months to come in our community. So first, I wanted to say thank you. And I also have, as does Matt Kelly, great confidence in your abilities as operators to navigate this new normal in innovative ways. We also wanted to just share that we realize that not everyone, not every establishment is going to do this perfectly every single time. So we really just wanted to provide all of you some guidance to get you started and give you an opportunity to ask questions as you have them, and then also share amongst yourselves. I'm certain that many of you already have some great practices in place that you might want to share with others. So at that, I'm going to go ahead and get us started with our presentation. Okay. So I just want to remind everyone that our goal is, like I said, to help all of you as we phase into reopening, allow for businesses like yourself to operate while managing risk to public health. We want to provide you guidance, and we want to be your partner and offer support wherever we can. So this is just a quick overview. I know a lot of you may have seen this before, but I just want to make sure all avenues are covered in terms of our reopening timeline, so that if there's any questions out there, you too can be advocates to explain to others in your profession and amongst your peer groups what the governor's reopening timeline looks like. So April 26th, the stay-at-home directive expired for individuals. April 26th, places of worship could also operate with reduced capacity and strict physical distancing protocols. April 27th, that is today, the directive expires for non-essential businesses. So retail businesses, as well as personal care services, such as yourselves, may become operational with guidelines for additional safety and health precautions. Later on, May 4th, restaurants, bars can become operational, again, with strict physical distancing and reduced capacity protocols. And then May 7th, schools have the option to reopen. But again, to reiterate, that decision will really lie with the local school boards. Again, it's just important for all of us to remember these things, that the virus is still in our community. It still remains dangerous, and in our nation, it's still dangerous and widespread. So we need to avoid groups of more than 10 people. Vulnerable individuals should continue to stay at home and take great caution by avoiding groups and really staying home whenever possible. The restrictions for individuals in terms of the stay-at-home directive, vulnerable population groups should still really isolate and stay at home as much as possible. If you're sick, people should stay home and call their doctor. Continue to wash hands frequently and thoroughly, disinfect surfaces frequently, and use face coverings when social distancing is difficult in public. So with that, I'm going to turn it over to Megan, and she's going to walk through the reopening guidelines for personal care service establishments, and then we'll go into some questions and answers.
All right, so hopefully you guys have all had a chance to look through the full directive that the governor issued last week for the reopening phased approach. This is a picture of it, so if you have seen it, you'll recognize this. If not, you can find this directive on our website at healthygallatin.org, and we highly recommend you go read through that. These are the guidelines in Appendix A that are specific to personal care. So these are straight from the directives guidelines, and we're going to go through these in more detail. What is bolded in the slides to come are straight from this directive guidelines. So we just want to remember to be washing our hands continuously and often throughout the day whenever necessary. We are recommending that staff and customers are wearing face coverings as often as possible. And then there's an example of social distancing down at the bottom there, that you guys might utilize something like that in your waiting areas. So we'll start with customer safety. So prior to scheduling any appointments for services, it's really important that you guys screen your customers for symptoms of fever, shortness of breath, cough, fatigue, asking questions if they've traveled recently. That's all really important that you guys do over the phone before you even schedule an appointment for them to come in. If they have any of those symptoms, please ask them to reschedule when they're feeling better. We are going to recommend that you're placing posters that will encourage staff and customers to stay home when sick and practice good hand hygiene. And an example of that poster is right here in the slide, and we will have those on our website so you can download them and print them off and hang them up yourselves. We also have one other option if this one isn't as pleasing to you. And then face coverings should be utilized by staff, and you should also request that your customers come in with a face covering as well, since you guys cannot meet the 6-foot social distancing when you're performing tattoos, piercings, or hair services. You're definitely closer than 6 feet in those situations. And then it's important to remember those face coverings need to be washed routinely, depending on how often you're using them. And then we wanted to just talk about face coverings for a little bit. They're great tools to help prevent the spread of germs, but if you're not using them appropriately, they can really become a cross-contamination source. So you always want to make sure you're washing your hands before you're putting your mask on and after you take it off. And you want to be covering your nose and your mouth with the mask, not just one or the other. And then constantly touching your mask to readjust it is not going to keep you from preventing the spread of the illness if that were the case. So we're going to show you a little demonstration, a video that we found on contamination with masks.
Brock, can you give me a thumbs up if you see that?
Okay, so hopefully you guys could all see that. It was just a great demonstration of how often you can contaminate your mask by touching your face and not washing your hands before. Oh, perfect. Okay, so we want to make sure that when you guys are providing services, you're still attempting to keep the 6-foot social distancing as often as possible. So even if you and your client cannot be 6 feet apart, then you guys should still make sure that you're 6 feet apart from other staff or clients that are in the establishment as well. So keeping your workstations 6 feet apart is required. That might require you guys to reduce your capacity of staffing closing off workstations, increasing space between workstations, or providing a physical barrier between stations to reduce that amount of contact time between customers and staff. Some examples of that is rotating staff to work in the facility on different days. And also if you have like retail shopping in the front of your store, then minimizing that so you have less people kind of walking around and hanging out. Seating in service areas or waiting rooms should adhere to 6 feet social distancing as well. So if you cannot meet those 6 feet social distancing requirements, you should just close your waiting or service areas altogether. Okay, so these are going to be some additional recommendations that you guys can do to help minimize contact time and the risk of being, you know, within 6 feet of your customers. And one example would be using electronic payment options to minimize handling of money. So entering like credit and debit transactions manually is a good example. We're recommending removing items in common areas that cannot be sanitized, like books and magazines. Requesting that your customers attend their appointments alone. It's pretty common that customers will bring friends or family to like body artist appointments. So just requesting they come alone is better. Conducting consultations remotely so you can limit in-person traffic in your establishment. So if you guys have like hair or tattoo consultations, if you could do those over Zoom or FaceTime, that would be recommended. Place hand sanitizer in convenient locations and multiple locations throughout the facility to encourage hand hygiene among staff and customers. And then consider the amount of services you provide. Consider limiting that so that you guys aren't, you know, providing multiple services to one customer that may not be necessary, and you can prevent the time that you guys are spending around each other. And then it's important to allow adequate time in between customer appointments so you guys can clean and sanitize and allow for proper air drying. I'm gonna see if we have anything in the chat. So we have a question in the chat. We'll get back to those questions once we finish the slides and start our question and answers. Okay, so cleaning and sanitizing is super important during this time. We're asking that you guys sanitize your frequently touched surfaces, which would be, you know, door handles, sink faucets, tables, workstations, pens, chair backs, light switches, all of those things, at least every 2 hours. Obviously more often if necessary, and after each customer procedure. But we want you to be using an EPA approved sanitizer. An example of those you can find on the EPA website, and this picture right here is what the website would look like. And so sanitizing those surfaces every 2 hours or more often if necessary. Daily disinfecting is recommended to be done at least once a day at the end of the day, and you can use a diluted bleach or chlorine solution. The disinfecting concentration for that is 1/3 cup bleach per 1 gallon of water, or 4 teaspoons bleach per 1 quart of water. And just remember, this is much higher strength than sanitizing, so you'd want to do this at the end of the day, so when you guys take off, it'll have ample time to air dry. So when you come back in, it should be good to go. And it's important to remember that if you notice your surfaces are dirty, you need to clean those with soap and water before sanitizing or disinfecting will be effective. Okay, so some employee practices. Staff must be self-monitoring daily for COVID symptoms, and staff need to be aware that they should not come to work if they have fever, cough, or shortness of breath. We obviously want staff performing hand washing frequently throughout their shifts, and obviously every time necessary. And Staff should be maintaining a safe distance between themselves and customers. We kind of covered that already. Staff should definitely be wearing face coverings when they are performing procedures on clients. We're recommending the face coverings be handmade or face coverings that are not surgical masks. We want to keep those for our healthcare and our personal or first responding staff. If you guys have those types of masks already in your possession, obviously you can utilize those, but we just don't want people going out and buying bulk of those surgical masks. So we are recommending you guys try to use cloth face coverings if you don't have the other types of masks. And then obviously remind staff that if they need to cough or sneeze, they need to do that in a tissue or an elbow and to wash their hands afterwards. So this is the guidelines from the Appendix A of the Governor's Reopening Directive. This is specific to individuals. So we want to just touch on vulnerable populations. So those individuals that meet the definition of a vulnerable individual that you see here. You just want to take extra precautions when you're scheduling appointments with them. Maybe recommending right now that if they can hold off on the appointment, that they should until we're a little bit more comfortable with what's happening in this situation. Making sure that they're taking extra precautions as well if they do come in. And then all individuals are still advised to be wearing face masks and staying in groups under than 10 and social distancing as much as possible. So we linked some of the resources, the Governor's Directive you can find on our website, and then also the posters for your front entrances that will encourage staff and customers not to come in when sick will be on our website, as well as regular updates and information. So feel free to utilize our website for additional resources. And then if you guys do end up having any questions that we don't cover today or any concerns, you can always call the call center, which is staffed with health department staff at 548-0123, or you can email the call center at the call center at readygallatin.com as well. Okay, so here are both the posters that are going to be found on our website that you can print off and use for your business. Okay, so that was the end of our slides.
All right, it's great. So we'll go ahead and start with a couple of the questions that one question we got in the chat. So as of right now, you can either type a question in the chat, or what I'll do is, based on the gallery view that I see, I'll just call on you, and if you have a question, go ahead and ask your question, as well as if you feel like sharing some of the practices that you're doing in your establishment or plan to do in your establishment. We'll just go around the room in that regard. Okay, so the first question was from Amanda. Any chance that you can discuss the profession of massage, i.e. hand-to-skin contact for more than 30-60 minutes? Yes, so the Governor's Directive for personal care services includes salons, massage, body art establishments. So we recognize, as well as the Governor's Office and Department of Public Health and Human Services, that these operations do require close personal contact for an extended period of time, and that obviously includes massage, which is why the guidelines that were provided in terms of wearing face coverings, as well as proper sanitation and disinfecting, really carefully screening your customers, scheduling appointments only, and then also really screening your staff as well, so that they're self-monitoring and making sure that no one who is ill is coming into your establishment. So I don't know if that answered your question, Amanda. If you have more that you would like us to try and address, please go ahead and type that in the chat. For right now, I'm going to go ahead and move into other questions. We'll start with Brock. You're the first one that I see on our screen. So if you have a question, feel free to ask it. If not, then if you want to just take a minute and share, really just a minute since we have about 30 people on the line today, share what your plans are for reopening.
Well, for the most part, I was taking this class because we're a hotel restaurant area here. So I was just trying to see what you had for better practice than what we're already currently ramped up for. And curious if you're going to have classes for this for the hotel restaurant industry.
Okay, yeah, we're currently working on our guidelines for the restaurants and hotels. Those are not posted on the website yet, but they will be once they're complete. And we will host webinars like this for the restaurants and bars when that time comes. Hopefully we'll have that type of information out by the end of this week. So just checking our Healthy Gallatin website or calling the call center for information on that would be great.
Well, no, that's good. Hopefully it's not the day of, because we'd like to be open on the 4th type of a deal. I mean, currently I'm building sneeze guards that are washable, cleanable for the host cash register counters. We've already separated out our tables and reduced seating capacity for when the time comes. Through our hotel, we're wiping everything down every hour, even though we don't have any customers at the moment. Just trying to practice good safety for when the time comes. So.
That's great, Brock. So we will host webinars like this for bars and restaurants, and we will have materials up. My hope is that by the end of the day, Wednesday, if not a little bit sooner, and we're going to push that out to everyone so that you have those to take a look at. So we are working on that.
Perfect. And I know I wasn't on this list. I just caught up with it because it was on the news this morning to see it. But if you could send out an email to all of us to know that it's happening so we could actually participate.
Great. Thank you.
Thanks.
All right. So we'll go to I'm sorry, I can't read the G. Horrell. Do you have a question? Or a comment? Okay. Seeing none, I'll go ahead on to Terry Smith. Do you have a question or a comment you want to share with the group?
Yeah, I'm a salon employee here in Bozeman, and we had our meeting the other day to reopen and discussed clientele being required to wear masks. Are they required to wear a mask, or is this just a suggestion?
So the governor's order has guidelines for personal care that say staff and customers should utilize face coverings when practical. So interpreting that in a way of, keeping you guys in the community as safe as possible, it would be best that customers and staff wear a face covering during your guys' procedures, since you are in close contact with each other and you can't keep that 6 feet social distancing. But it does not say it is required.
It is not a requirement.
It is not required.
Okay, thank you very much.
Yes. I do see in the chat, it says someone heard a rumor they cannot have AC on, windows and doors open and closed. That's not, that is a rumor. We have no guidelines saying you can't have your AC or windows or doors open. So we'll move on.
Okay, Rachel, do you want to go ahead and ask your question if you have one? If not, we can just move on as well.
Yeah, I am a massage therapist here in Bozeman, and the clinic I work out of is going to be requiring that to be in the building, everyone be wearing a mask. So that includes clients as well. But I have concerns just with being in close proximity for an hour to 2 hours. And right now it seems like the masks that are available still don't have a, really high filtration rate like you'd find with an N95 masks. And when you're working on a client's head, you're like, a foot away from their face. And so I know right now you can, businesses can request masks, the handmade masks that the hospital has like a pattern for, that a filter can be inserted into. And I'm wondering, since right now we don't have access to N95 masks and should not be trying to get those, if you have suggestions for filters that can be placed within those masks and what masks would best protect us.
Yeah, so the cloth face coverings are the ones that we continue to recommend that the general public, as well as individuals who cannot maintain that 6 feet social distancing, which is again, some of you. And I understand, so if you think about what the purpose of the mask is, so it's really, you know, to protect the other individuals from you, right? So as you're talking and going about your day, working on someone's hair, that acts as a barrier to prevent any respiratory droplets from leaving you and moving into the customer. So it's the idea is that it's not necessarily a two-way filtration. It's really meant to be protective of the customer. So I don't have any specific recommendations in terms of what types of filters can be inserted into cloth face coverings at this time. Again, the best things that you guys can continue to do is ensure that people who are coming into your establishments are healthy, and that at all times workers as well as customers are practicing good hygiene. So again, why we shared with you the video of the mask, cross-contamination. Even if you're wearing a mask with filtration devices, you have to be really careful about how you're using that when you're out and working on people in public. So I'm sorry I don't have an exact, this is exactly the type of filtration you should be using, because I really haven't seen anything specific to that. But we'll keep looking. And like Megan said, as we have more information that becomes available, as you know, this has been a rapidly evolving situation, we'll push that information out as quickly as possible to all of you. So I'm going to go back to Rachel Just, I think is the individual that I see next. Do you have a question, or do you want to share a best practice that you are instituting in your establishment?
I actually don't have a question. I'm just listening in.
Great. All right. That's wonderful. Thank you for joining us. How about Sarah's? It's coming up as Sarah's iPhone. Do you have a question or a comment to share with the group? Nope. Okay, we'll go to Dianne. Dianne, do you have a question or a comment to share with the group? Great. Tiffany Dykema, do you have a question or a comment to share with the group? All right. So at this point in time, I'll just go ahead, and since some folks are taken off, and that's okay, I'll go ahead and open it up to anybody who has questions, or if you want to share best practices with those of you that are on the line. I'll go ahead and open it up to conversation. If you want to unmute your phone and either ask a question or share information for the good of the group, you can do so at this time.
Hi there, Amanda Martin. Excuse me. Thanks for having this. And gosh, unfortunately, I didn't find out about it until literally 2 minutes ahead of time. So I can relate to the gentleman with the hotels. So thanks for doing it. And this is all happening pretty rapidly for a number of us. Quick question that I seem to get from fellow colleagues. As a massage therapist, we tend to have a lot of laundry. So there have been things, and this might pertain to you in the hotel world as well. you know, how some of us have on-site laundry, so we can immediately take our linens from the table to the washer, to the dryer, what have you. But then there's some people who have off-site laundry, and we're doing it in their homes and that kind of thing. Can you talk about maybe some best practices that you are recommending when somebody has to take linens or supplies of that nature, you know, out of their contained environment?
Yeah, totally. That's a good point, Amanda. And we held one of these webinars just on Saturday, and somebody brought up washing the capes that you wear at a hair salon in between each customer, and that is recommended that you do that during this time. So dirty laundry, if you have used any of the linens with one customer, we obviously want you to wash that before you're using it again. So putting it in a laundry bin or a garbage bag or some type of container that you're using specifically for dirty linens, that could either be washed when you wash the dirty linens, thrown away, or that is like sanitized, like a material that you can sanitize. So like a plastic laundry bin that you can like label as dirty, and then once you empty that, you can sanitize it with like an EPA approved sanitizer and let it air dry. Or if you just have a cloth bag that's always for your dirty laundry that you can wash at the exact same time, that would be recommended. We obviously don't want you using the same laundry basket multiple times with clean and dirty, because then you're just going to recontaminate. I hope that helps answer. Oh, right. Yeah. So utilizing hot water when you're washing your linens and drying your linens on high heat will help with killing any germs or pathogens.
The only thing that I would add to that as well is that in terms of like shaking out your dirty laundry before you pop it into the washing machine, just try and refrain from shaking linens out and then putting them in. Just put them in, and again, just as good practice would be, you'd wash your hands thoroughly after putting your laundry into the washing machine. But at this time, because of the type of virus it is, it does, the outer shell of that virus does break down with soap and water, which is a good thing, which is why practicing good hand hygiene is so critical right now. So if there are any virus particles or any other pathogens on any of the linens that you guys are using, just your regular washing routine with those is going to be effective. So that was a great question. Thanks, Amanda. Does anyone else have a question at this time?
I see there is something in the chat asking about blow drying hair. It is okay to blow dry clients' hair. We would recommend, obviously, that you have your client wear a face covering if possible when you're doing that. And then if they didn't have a face covering when they came in and you don't have one for them to borrow or use, then just making sure that if they need to cough or sneeze, that they give you a heads up so you can turn off the blow dryer before that happens and prevent it from being spread throughout the facility.
Diane, did you have a question?
I do. When the governor came out with the directive of who was going to be allowed to reopen in phase 1, do you have insight as to why the massage therapy industry was included in that?
I do not. I do not. Yeah, I'm sorry. I wish I had. We definitely, as local public health agencies, work really closely or have worked really closely with the governor's office. I think part of, as I think through it, because especially, salons and tattoo artists, etc., they are really licensed, and there are some really specific guidelines for sanitation and disinfecting that they're already really knowledgeable about. And I'm imagining that massage therapists were kind of brought into that fold because of the careful practices that you institute as a business already. That said, one of the things that I want all of you to think about is just because the governor said that you don't have to open today, you can take your time and transition into the normal that works for you, as well as thinking about what the unique situation is that you have in your type of establishment. So maybe you need to reopen differently than a colleague down the street because they have a different type of practice. So I realize that this feels really rushed to every one of you, and I understand that. We were also rushed to try and get as much information out as we could to all of you. So just know that if you don't feel ready, again, the virus it's still serious. It is still unfortunately taking people's lives and making people really sick. So take that into consideration as you work through how you want to reopen safely so that you can stay open.
Right. I have a follow-up question to that then. So we know that Missoula, whatever county that is, has reconsidered the directive for themselves personally as a county.
Yeah.
Because we've been one of the hardest hit counties in the state as Gallatin County, I have personal concern that we're not really mitigating the spike in the curve by allowing people to go back into their offices and perform massage. And I've kind of been all over the map with this personally. I am a microbiologist by education, and it's really difficult because on the one hand, for me personally, I'm not seeing a ton of clients every single day like a spa would. So I have a little bit more control, but it just feels as though we're perhaps in a precarious position as it relates to the curve itself and our industry in Gallatin County. Mm-hmm. What happens if it is noticed that the cases begin to spike again?
Yeah, that's a great question, Diane. And that's something that our health officer, Matt Kelly, has worked closely with the medical professionals and the state to try and identify really specific metrics. Those metrics for what, again, as you know, the governor didn't set a phase 2 reopening because it is going to be very dependent on what happens next. So for example, metrics that we would be looking at as a county are, the number of new cases, number of hospitalizations, and really how many active cases we continue to have in the community. We don't anticipate, I guess I would say, it's very likely that we'll get additional new cases. So it's all of those need to be thought about collectively in terms of what does the next phase look like? Can we move out of phase 1? Those are all conversations. Again, I'll be honest to say we don't have all the answers to that now because we've never experienced this pandemic for this particular virus before. So I guess that's a good way, or my best way of trying to say, be patient. We're trying to continue to work through, what a next phase looks like because we want to be able to balance public health risks and also businesses who want to reopen the opportunity to reopen.
Right. I understand that too. I think we're all in a bit of a quandary and we just don't, for some of us, we really just don't know which way to head. And so, it is boiling down to personal responsibility and comfort zone at the end of the day.
And we want to continue to protect our most vulnerable populations. So all those pieces together, I think you said it really nicely, Diane, that it becomes personal responsibility in a lot of ways here, which is why we continue to share the message about social distancing and practicing good hand hygiene and limiting your contacts within groups.
Mhm. I guess my concern for many people is that there is an economic pressure for a lot of people to get back to work, which it is in direct conflict with the morals and values and the ethics and of our industry in general. And I can really understand where a lot of people are coming from. I haven't looked into this, but if people choose not to go back to work, are they still eligible for unemployment?
Yeah, I got that. We had that question from Rachel in the chat box as well, and I do not have the answer for you. I wish that I had that at my fingertips. What I'm going to do is, I wish that I had brought a phone number for the state Joint Information Center where you can call and ask. And I would also say too that you may be able to call the Department of Labor and Industry. I'm sure their lines are ringing off the hook right now with that very same question. So Megan's going to look up to, oh, she found it. Good. Go ahead and type it in the chat box. So while Megan's looking at the number for the Joint Information Center to ask at the state, it's basically an email and a 1-800 number that you can potentially ask that question to, because I do not have that. Nicole, I'm sorry, it's impossible to get through. But what we'll do is we'll try and find answers for those questions as well. And the best way that I know we can share that information is through our call center. So as we get more information, if you can continue to just touch base with us to see if we have additional information, as well as our website, we'll try and get out information in that regards to your specific questions like that.
Okay, thank you so much. I think that's all I have. I appreciate that you guys have done this.
Thank you. I appreciate you guys calling in. Is there anyone else who has a question that they want to bring up? If not, we'll give it another minute, and then I'll let everyone know while you're on the line right now. This will be available as a recorded webinar on our Healthy Gallatin website, and the resources that Megan shared with you earlier will be also are already also on our website under COVID-19 reopening phase 1. We've listed all the different types of establishments, and we have printable resources on the right-hand side of the page, like that stop information about customers not coming in when they're sick, and also some self-monitoring guidelines that you can have your staff adhere to when they're coming into work as well. So we'll give it another minute, and yes, Barb, I will post the answer on our Facebook page for Diane's question as soon as we have it.
Hi, my name is Tammy. I have a quick question regarding my massage studio. It is obviously a rented space in an office building that I have no control over, and it's carpeted in the offices. Is there any concern with that?
Carpeting specifically?
Just with the germs being airborne, I mean, should I look into some alternative flooring to put over the top of the carpet that can be taken out if I should vacate the building, or what do you suggest?
I don't think that alternative flooring would be necessary. I think obviously making sure that you're screening your customers before they come in and being really open with them about that you do not want to be working with anybody who's had any illnesses or any symptoms recently, and that staff will not be coming in if they've been sick recently as well. Utilizing hand washing, being as sanitary as possible, and then obviously you can shampoo your carpets if that makes you feel better on a more regular basis, but we wouldn't necessarily recommend or request that you change your flooring.
Okay, thank you.
Mm-hmm.
All right, we'll go ahead with one more question if anyone has one.
Yeah, this is Rachel again, and I just have a question just because it would be helpful for just personally deciding when I would open my practice. I guess I have some concerns with just, with being in phase 1 and people coming in who are asymptomatic and myself possibly being asymptomatic, and just kind of going back to the mask issue and just, not being able to fully guarantee that there's not particles hitting a client. Yeah, just sorry, I lost my train of thought there a little bit. Oh, I'm sorry. Yeah, but just how, like, I don't know how we, like, with being asymptomatic, just like, sorry, that's where I was going. So with phase 1, I have like this understanding in my head that I'm not sure if it's correct or not, is just that once we would enter phase 2, you can make the assumption that there would be just less cases of COVID in the community, whether they're symptomatic or asymptomatic. That's the assumption I have in my head. But with phase 1, is there going to be a point, like, is it 2 weeks, 3 weeks that we'll know kind of more about the numbers in terms of individually being able to make some choices for our own practices?
Yeah, so like I was mentioning earlier, some of the numbers and metrics we'll be following are those case numbers. And just as we have been following them, as you all know, there's a period of about 14 days where if someone was exposed to COVID, that they would potentially start showing symptoms. So that's why we look at things, kind of on a 14-day timeline. And so we like to see a reduction in cases over that period of time, which is what you guys have seen or have maybe heard in the news about how we've been able to really flatten that curve. And to the point of over the weekend, we had 0 new cases. So we want to continue to see that throughout this first phase, knowing that we will potentially, because more people are moving about, we'll get additional cases. But that doesn't necessarily mean that everything has to shut down again. I think for you all to sort of think through is what happens in phase 1, as the governor has shared, is phase 2. There are no changes in terms of, at this point in time, what happens between phase 1 and phase 2. So what you're setting up as your practices in this first phase will likely continue for several months. I'll be honest, it's likely going to be several months that you'll be practicing those procedures and protocols that you've put into place during this initial phase. Does that help, Rachel?
Yeah, it does. I mean, I think it's more just also just trying to decide, like, when it feels, especially within massage where you have such close contact, when, just in terms of the number of asymptomatic cases out there, when we're going to be at a lower risk than we are right now in opening up.
Yeah. So, I mean, thinking about, a close contact, especially if you're in close contact with someone where you don't have a face covering, a close contact by the definition that we're using is really like being in that same space for 30 minutes, for 30 minutes where someone is maybe not wearing a cloth face covering or face covering at all. So, thinking about yourself as a massage therapist, are there opportunities where you can shorten your interactions? Or again, like I said, just be really careful about screening your customers and patients, or your customers, before providing services. So those are things that you can kind of think about as well.
This is Nicole K. I'm just curious why massage therapists were released in phase 1, given the close proximity, the length of time we spend with our clients, and that we're in a typically a smaller closed-in space. There's nobody else out there really like that, unless you're like a dental hygienist or that has that type of contact with their clients.
Yeah. So Nicole, this question came up a little bit earlier too, and all I can say is that I think that in the governor's guidelines, I can't speak for the governor or how that decision was made specifically for massage therapists. I think they recognize that because you're in close contact for an extended period of time, you could potentially be at greater levels of risk, which is why it's really important to screen the customers, use a face mask, and provide that social distancing between workers and different stations. So I can't answer your question directly about why the governor included massage therapists in this in terms of this first phase, other than again, thinking about the practices you already have in place, and the ability for you all to really be carefully screening those individuals that you come into contact with in your establishment, I think is easier for you guys to do than maybe some others. Looks like Amanda has her hand raised. Amanda, do you have your hand raised?
Yes, I do. I just had a quick question in reference to the video that you guys showed.
Sure.
In regards to the mask contamination. Would it be recommended, at least, and you can speak this profession specific, I suppose, or general, would you recommend, if our clients are coming in and they have their face mask, one would assume that the outside of their mask is, it's meant to protect them, but if something would be contaminated, it would be the outside of the mask. Would you recommend that we have masks here that we provide? So for instance, we have a client who is face down, they're prone on the table, and then when they flip over, that we would get our own disposable masks or what have you, or perhaps theirs, and then put that over their face for being in close contact. Does that make sense?
I think I understand your question, but are you saying should you guys provide or cover their face when they're face up, if you're working on them on face up? Is that right?
Yeah. Yeah, and just with the risk of being with the outside of their mask being contaminated per se, if we were to put the mask on them or have a sterilized mask after they've been face down, drooling, snotting on the table.
Have you ever thought about that?
Well, what I was thinking is that table that they're laying on should be sanitized between each customer anyways. So if they are laying on it face down, then the germs that are on their mask are likely from them, because hopefully they're routinely washing the mask that they wore there. So we're assuming that their mask is clean, and then they lay face down with their germs, and they turn around. Now the germs are just on the back of their head, but it's them. So when they are done with their procedure, you will sanitize that table after them. So I don't think that there's anything additional you need to be doing. If you want to provide cloth face coverings to your clients and launder them at the end of each use or day, put them in a dirty bin, that's definitely up to you.
This is Nicole again. I know most of the people that are attending, and I know we all follow universal precautions, which what you just described is included in that. I think Amanda was talking more to the point of having both a face mask on your client and on yourself in a supine position or face up position, given that we're anywhere from, you know, about a foot away from our client's face.
Yeah, we were definitely recommending that you, the staff, as well as your customer, utilize a face mask when you're not social distancing at 6 feet. So pretty much the entire procedure. Hope that helps.
Amanda, do you have another question? Or does anyone else have another question? Okay. Well, I really appreciate all the questions that everyone's asked. They were great questions. We do have these slides on our website, as well as the resources that we went over. So continue to check back, not only to the post so that you can look for an answer to one of the questions that was asked earlier by Dianne, but also to continue to look back on our social media accounts for additional guidance as it becomes available. And as Megan said, we will have our staff available at the call center, and you can also email. So the call center number again is 548-0123. Again, 548-0123. And we hope all of you stay healthy and happy. We will continue to do our best to be good partners and provide you the information as much as we have available to all of you as well. So with that, we wish you a good day. Take care.